Good evening, everyone. Welcome back to My IVF Answers. It's great to have you here. As you can see, we have another special guest. Sofia Rodrigues is with us. Hi, Sofia. Hope you can hear me well.
Hello.
How are you
Yes, yes.
doing?
Everything okay? How are you?
Great to have you. Thank you. All good. I'm glad that we are here, and we will talk about social freezing today, embryo banking, and of course, Sophia will walk us through it all. Remember that we will start with Sophia's presentation on our topic, and there will be time for your questions after the presentation is done. Remember, you can put those in the chat section even during presentation. We'll definitely answer those for you. Sofia is the embryologist at Ferticentro in Coimbra, Portugal, and I'm glad that you are back. This is your second webinar, as we already discussed this before we started. So I'm glad that you are back. And listen here, everyone, as you know, we are simply here to support you. And of course, with fertility webinars, but as you know, we hope that you are well taken care of wherever you are going through the treatment. And of course, I also wanted to add that European Fertility Society is also looking for some volunteers. Okay, so if you wish to support us, if you wish to help us out, there are some options you can help with. So I'm sure. So please go to the chat section. There is an email address, Caroline at European Fertility Society. And if this is something that you would like to know more about, just email me. I'll be happy to get back to you with some more details. And well, I think that we can start. Everyone, I hope that you can hear us. I think so. But just let us know that you can hear us loud and clear. And I think we can start. Sophia, are you ready to start with your presentation?
Yes, I'm
Brilliant.
ready.
Glad to hear this. This is the presentation. And let's go ahead. Let's go ahead with it.
Okay. Thank you for your introduction, Caroline. So we were talking about egg freezing versus embryo banking. What is right for me? So egg and embryo freezing are two valid forms of fertility preservation. Both have the same steps involved at the beginning of the process. Both involve stimulation of the ovaries to grow multiple follicles, and both involve the egg retrieval to remove those eggs. So if a patient wants to cryopreserve eggs, those eggs are selected by the embryologist after the egg retrieval, and they will be immediately cryopreserved. If a patient wants to cryopreserve embryos, then those eggs will have to be fertilized with the chosen sperm, and they will be left in the laboratory in culture from 5 to 7 days until the embryo reaches the blastocyst stage, which is the ideal structure for an embryo to be cryopreserved. And then we would cryopreserve embryos. However, if a patient cryopreserves her eggs, she can then later come to the clinic to use those eggs. And in that case, we would do the exact same thing that we did to the embryos. We will just thaw the eggs, fertilize the eggs to create embryos to be transferred. Okay, so basically the beginning of the process is the same until the egg retrieval. It just all changes in the lab based on what you pretend to do with those eggs, or cryopreserve them or fertilize them. So there is always the chance of loss during the thawing process for both embryos or eggs. So an egg survival rate is between 80 to 90%, while an embryo survival rate is higher than 95%. So these rates are about the protocol that we use which is vitrification. There are a lot of methodologies for the egg and embryo cryopreservation, but here we are talking about vitrification in specific, which is the most used protocol worldwide, and it is the one that has higher success rates, higher survival rates after the thawing. So we can see that the survival rate for eggs is a little bit lower than for embryos, and this is due to the fact that the eggs are single cells, and and a single cell, it's much fragile and much more sensitive to the process of freezing and thawing, and it is most likely to be damaged for that process. The success of the thawing of the eggs is also related with the quality of the egg itself. And this quality of the egg is tightly linked with the age of the egg, which depends on the age of the woman that wants to collect the eggs. And as you can imagine, the quality of the egg decreases with the increasing of the age of the woman. So younger women have higher chances of higher survival rates for the eggs. As far as the embryos, so it is actually very surprising when an embryo doesn't survive the thawing. Then this is due to the fact that the embryo is composed by 100 of cells, and it gives them a stronger structure, which is more resistant to the cryopreservation and thawing processes. However, this factor alone, these survival rates, should not be the main determinant to choose between egg cryopreservation or embryo cryopreservation. We should also take into consideration the following advantages and disadvantages that I will mention now. Okay, so one of the biggest advantages of egg freezing is that egg freezing doesn't require sperm. So eggs are frozen unfertilized and can be stored for a later date and to use later in life. This is an optimal choice for single women who haven't found a partner yet or haven't decided a sperm donor yet. It also involves the patient itself, the woman, and this gives reproductive autonomy to the woman because she can, like this, preserve her own fertility independently, whether she has a partner or not. So all this makes gives us a higher flexibility to make different choices by cryopreserving the eggs. Also, freezing eggs brings less ethical considerations compared to freezing embryos, because we know that an embryo is a certain form of life. We know that the embryo will implant and generate a living being. So it's easier for us to discard ovocytes rather than embryos, if that's the case. The disadvantage of freezing eggs is, as I told before, the lower survival rate after thawing. It has a lower survival rate compared to embryos, and we are not sure how many eggs will survive the thawing, and we also are not sure among the surviving eggs how many will actually fertilize and develop to blastocyst. So by this, we need more eggs to improve the chances of pregnancy, because we need a lot of more eggs in order to get a pregnancy. Then we need embryos. We need basically just one embryo in order to get a pregnancy. Also, the egg doesn't give us a lot of information. We don't know about the quality or the genetics of the eggs because we can't actually test it, or we would destroy the egg. So this is also a disadvantage of cryopreserving eggs. So embryo freezing. One of the advantages is that it has a higher survival rate after thawing, as I mentioned before. We can see actually the development of a fertilized egg until the blastocyst stage. So we actually have a lot more information about what we are cryopreserving. When we cryopreserve eggs, we don't know how many will fertilize. We don't know how many will reach the blastocyst stage. And if we cryopreserve embryos, we have more certainty about what we are freezing. Also the blastocyst is a structure that allows us to do a biopsy. We can remove some cells of the blastocyst in order for them to be genetically tested. And by this procedure, we can also get even more information about an embryo. We can know about its genetics, and we can actually know if it's going to give place to a viable pregnancy or not. So all of these advantages gives for certain a higher success rate of the embryo cryopreservation rather than cryopreserving eggs. The disadvantage is that it commits us to the sperm. So if a woman later in life chooses a different partner, she may not be able to use those embryos. Okay, because if both gamete providers split up, the woman cannot transfer those embryos without the consent of the other partner of the embryo. So this can raise some legal issues about the transferring of these embryos. So after all, which is better for me? So in the end, the procedure that's best for you really depends on your current social situation and your goals. If a woman later in life, although there is a lot more certainty about cryopreserving embryos, we have a lot more success rates cryopreserving embryos. We can't deny that X gives us more flexibility to do more choices in the future. And if you are a single woman and want to preserve your fertility, then egg freezing may be the best option for you. But if you and your partner plan to have children in the future, but want to delay the pregnancy, then cryopreservation of embryos will be an option to consider. But the truth is that couples don't always stay together, and if you change your partner, you may not be able to use the embryos that you created before, because transferring of those embryos require the consent of both parents. So, as I told also before, this can create some legal issues also about the transferring or destroying these embryos. And now we can also ask, what if the eggs are fertilized with the sperm donor? So freezing embryos with the sperm donor means that you can't use those embryos also if you find a partner later in life, because I suppose you want to have biological children with your new partner. So you won't be able also to use those embryos. So it really depends on your plans for the future, and regardless of your social condition, you should definitely discuss all of your options with a specialist before you make any decision. Okay, so that's it. If you have any questions, please feel free to. I will be here to answer you.
Brilliant. Thank you so much, Sofia, for your presentation and explaining what's the main differences between, of course, egg freezing and embryo banking. So, as you said, this is up to your situation, in whatever situation you are.
Basically,
you can choose either one. Either one of those. And right now, as you mentioned, this is time for your questions. So I see one question, but of course, if you have more, go ahead, type those in, and I'm sure Sofia will be happy to help you out. And let's see the first question. Okay, Elle, thank you so much for your first question. The question is interesting. Is the egg freezing painful, and are there any side effects on patients, like losing natural fertility, bleedings, early menopause? Thank you for the question.
So, well, the egg free, all of the stimulation and the growing of the follicles, it's a really long procedure that it takes place during several weeks until we have all full-grown follicles with eggs inside. We can consider it a little bit painful because we have to have injections every day, basically. However, if you're not afraid of needles, there's no problem for you. But the egg retrieval itself, you are under a sedation, so you don't feel anything. So I don't say that it is a painful procedure at all. However, it can have side effects, of course. You can be
Mm-hmm.
overstimulated. You can feel some pain in your abdominal area. But of course, I think we have, fortunately nowadays, medication to attenuate those symptoms. And yeah, I think it depends on each woman, the tolerance for the pain, of course.
Right. All right. Thank you so much, El. And anything you can say? I know that about, I mean, about the cost, including the cost of storing until use.
I know it depends on country to country, clinic
Mm-hmm.
to clinic, of course. If you only want to cryopreserve your eggs, it is for sure it's cheaper, okay, than cryopreserving embryos because actually a fertility treatment involves a lot more costs for the clinic and so for the patient, of course. But so it is a little bit, it's cheaper to cryopreserve your eggs if you just want to preserve your fertility. But I can say to you exactly how it costs. Maybe one, 2, 3,000 euros. Of course, I'm talking
Mm-hmm.
about euros,
Of course.
but it depends from clinic to clinic. Okay.
Obviously. Mm-hmm. Okay.
Of
Thank
story.
you. Oh, including the cost
Yeah,
of
I
storing.
didn't saw that. The storing, I think you only have to pay a fee each year uh, to maintain the eggs, and I don't think it is each year or a couple of years. I'm not sure also about that.
Mm-hmm.
But yeah, you have to pay something. It's not that high for a couple of years while you have your eggs cryopreserved there.
Okay. Mm-hmm. Thank you so much for your questions, El. Now we have a question. You already answered this, in your presentation, but let's have a look. Which is more preferable, right? Egg freezing versus embryo freezing, as per success rates.
So yeah, basically this was the subject of all presentation. Of course, it depends on your social conditions, whether you are a single woman or you have a partner. But I would say that egg freezing has for sure a lot of advantages. Um, a lot of advantages, and I would advise embryo freezing, of course, if you are sure you want to have children with your partner. But of course, as I also explained, it can be partner couples don't last forever. I know, and if something happens, you're not allowed to use those embryos. So we really need to think about that decision. Yeah,
This is definitely this decision you need to, you know, uh, take into, like, all aspects need to be taken into account, right? This is like
sure,
a definitely important
sure.
decision to make. All right. Hope that helps you as well. Thanks so much. And let's have a look. If a woman passed her menopause, is it still possible to get pregnant with frozen eggs or embryos?
Um, it is possible for a woman that has passed her menopause to get pregnant, but not with her own eggs. I'm afraid, because if you're in menopause, you don't have eggs available or with quality enough to generate a pregnancy, and maybe you will have to use eggs from a donor. But yes, here in Portugal, you can still get pregnant until you're 50 years old. So yes, it is possible, but with eggs from a donor, of
Or
course.
if you have frozen embryos,
Yes,
right?
sure. Yes, if you have frozen embryos before, yes, of course, you can transfer them. Even if you're in menopause, you can
Mhm,
transfer them as long as your endometrium is receptive to that embryo.
mhm. Okay. Hope that helps us again. Let's have a look. There are some details here as well. I have only 4 frozen eggs preserved. Now at 47, I still have monthly ovulation. Is there the slightest chance that I can go through the process of preserving more eggs? How does the process work if someone has cysts on one egg stock?
Let me just read again. Sorry.
Sure, no
I
problem.
have only for
Take your
eggs.
time,
Okay.
of course.
Well, yes, you can. You can go through the process of preserving eggs, more eggs, of course. Although when a woman age, the egg reservation also tends to diminish, right, with the age. So the probability of you to get a lot of eggs it's really low. However, that is just something you need to confirm, of course, with your doctor, with your specialist, because there is a lot of other factors that may influence the fact that you have eggs or not, that you may have eggs or not. But of course, you can try if your doctor thinks that you have all the conditions to do another egg retrieval or not. Okay, it's not just about the age; it's about also the egg reservation that you have.
Mm-hmm.
That I don't know, right? So how does the process work? Well, the fact that you have, if you have cysts, I'm not really sure. Uh, I'm not really sure about that. That's just more a medical issue, so I cannot really answer that question because I don't have enough information. Sorry.
Of course. Just to remind you, Sofia is an embryologist, so of course this is perfectly fine. Thank you so much. I hope that helped you, Natalie. Thank you for your question. I don't see more questions, so if you have some more, just go ahead. Type this in as we if you want to get some more answers. And in the meantime, I would like to ask you regarding the egg freezing. What kind of patients actually? I mean, how old usually are they when they come for egg freezing, more or less, of course.
If it is
At
just
Ferticentro, right? I mean,
sure. At Ferticentro, we usually we work with older patients actually, and it's not that usual that we have a woman that come to preserve the fertility. Of course, there is some, but yeah, usually until 35.
yeah.
More than 35, usually we don't. It's not that usual that women with more than 35 years old come to Ferticentro to do egg freezing to preserve the fertility.
Okay, well, because okay,
Yeah,
this is
it's
like I think this is the age that you need
yes,
to think about whether you want to want to have kids right
yes,
now or you want
sure.
to preserve it. Okay,
It is the critical age, right?
exactly.
Because after 35, our egg reservations start to follow, right? And
Yes, of course. And does it happen that some women at 40 is it still can come and still try to freeze her eggs?
sure, I think any woman can try to freeze her eggs. As I explained before, it depends on a lot of hormonal factors. We
Right.
need to do a lot of study in that woman to know if it's really worth to do the egg freezing. But yes, if all the factors are aligned and if she has a good egg reservation, why not?
Okay. So as long as the patient is evaluated, of course, then
Sure,
uh, that depends on the all the numbers, let's say, yeah, levels of hormones, etc. as well. Okay.
sure, yes,
Thank you.
yes.
In the meantime, one more question, probably our final question. So, would the AMH number show how good chance of egg preserving a person
Yes,
has?
yes, sure. That is a great factor to, uh, yeah, it's a great number to predict the number of the eggs that we will be able to to get in the egg retrieval. The higher this value, the higher is the number of follicles and the ovocytes that you have. So yes, it's a good number, and it is one of the requested parameters to be analyzed before we do the egg retrieval and start the stimulation.
Okay. So this is definitely AMH is always checked before you can even
Yes,
start egg freezing process, right? It has to be checked.
sure,
That's interesting.
sure.
Okay, thank you for the clarification. Natalie, again, thanks for that. And as I've mentioned, it looks like that was our final question. But of course, remember, you have more questions. You can still get in touch with Sofia
Sure.
Ferticentro team, and I'm sure they would be more than happy to help you with some other questions. Remember, it has to be personalized as always as well. Every
Yes,
patient is
sure.
different, so I think it's always best to get that. Whatever diagnosis or question you have to ask directly. But of course, thank you everyone for joining us tonight. I hope that was helpful. Sophia, thank you for your time. It's been
Thank
great to
you.
have you. Before we finish, any final thoughts? Anything else you would like to add?
Me? Sorry.
Sure.
No, I just want to thank you for your help, and I hope we meet again in this way in one other another webinar
Looking
sooner.
forward
I
to it.
think so.
For sure. Thank you so
Yeah.
much indeed. And remember, we will be back next week. We have two webinars. The first one will be on Monday at 5 p.m. UK time. We will talk about latest advances in art at IVF Live with Dr. Oliver Park. So I hope you will be able to join us. So hope to see you next week. Sophia, looking forward to some more events with you as well. Thank you so
Me
much,
too.
everyone
Thank
for
you so
joining.
much. Thank you for
Sophia,
watching.
thank you for watching. Exactly. Thank you. And of course, remember that we will be back. And so if you have more questions, I hope you will be able to join us next week as well. Thank you indeed. Enjoy your evening, everyone. And see you soon. Okay. Thanks.
Bye
Bye.
bye. Bye. Thank you.